So, this is a guided recording of Buteyko breathing. This is the breathe light method with hands on chest and tummy. So, you want to have one hand on your chest and one hand on your tummy. In Chinese medicine, the right hand is the giver and the left hand is the receiver. So you can choose whether you want to put right on chest or right on tummy. So after breathing in, slow and light, the breath should be very slow and relaxed. The breath out should be unforced, passive, gentle, and about 1.5 times the length of the breath in. The breath in during rest is active, and the breath out is passive. Allow the exhalation to happen naturally. So place your hands on your chest and tummy or on your lap. I'd like you to sit up straight so as not to compress the diaphragm. Imagine there's a piece of string pulling you upwards from the top of your back, top of the back of your head towards the ceiling. Lengthen the distance between your navel and sternum and widen the distance between your ribs. Pay attention to your breathing. I'd like you to notice the slightly colder air coming into the nose and the slightly warmer air leaving the nose. Look down at your breathing. Can you see your breathing? Feel your breathing. You shouldn't see your breathing. You want it to be so light that you can't visibly see it. Feel the slightly colder air as it enters your nostrils, and feel the slightly warmer air as it leaves your nostrils. Really concentrate on your breathing. Use this as a measure of your concentration. For how long can you hold your attention to your breathing before the mind wanders? If the mind is wandering a lot, you will get even more from this exercise. Keep bringing your attention back to your breathing. Feel the slightly colder air entering your nostrils, and feel the slightly warmer air leaving your nostrils. Now slow down your breathing. I would like for you to slow down the speed of air as it enters your nostrils. Breathe so gently that hardly any air enters your nose. Breathe so softly that the fine hairs within the nose do not move. Take a slow, light breath in through your nose. As you breathe out, bring a feeling of relaxation throughout your body. After you breathe out, wait until you feel the need to take a breath again. So there's a gentle, calming pause in between the exhale and the inhale. Then take a soft, slow, gentle breath in. At the top of the breath, allow a relaxed, slow, gentle breath out. I would like you to really concentrate on slowing down your breathing so that you are taking less air into your body. Don't hold your breath or interfere with your breathing muscles. Instead, soften your breathing so that the amount of air you are taking into your body is less than it was before you started. The goal is to create a feeling that you would like to take in more air. You want to feel an air hunger. In order to create air hunger, your breathing should now be less than what it was before you started. I need you to feel a want for air, a feeling that you would like to take in deeper breath. I would like you to feel air hunger. If your breathing muscles contract, or if they start to feel tense, then the air hunger is too strong. When this happens, take a rest for about 15 seconds and then start again. It's normal at the beginning to take a rest a few times during the exercise. With practice, it becomes easier to sustain the air hunger for longer periods of time. Soften your breath to the point of air hunger. You may feel increased saliva in your mouth. Your hands may get warm. You may feel sudden calmness, or you may feel slight panic. If you feel panic, then you want to take a rest for about 15 seconds. If you were to look down at your chest, you should see a visible reduction to your breathing volume by decreased movement of your chest. You shouldn't see your chest move. You want to be using your diaphragm. You want to see less air movement. You can continue to place your hands on your chest and your tummy, or you can have them in your lap. Continue to sit up straight so as not to compress the diaphragm. Imagine there is a string pulling you up from the top of the back of your head toward the ceiling. This helps you to maintain the correct posture. Continue to lengthen the distance between your navel and sternum and to widen the distance between your ribs. If you don't feel like you can do this physically, then imagine it in your mind's eye. Imagine distance between your lower ribs and distance between your navel and your sternum. If the air hunger is too much, remember you can rest for 15 seconds. You are looking for the sweet spot to achieve a degree of air hunger just below the point where your brain starts to react. You want to be on the verge of disrupting your breathing rhythm, but not going beyond it. When you breathe light, and with your mouth closed through your nose, you're helping your body to settle in to the rest and digest of the parasympathetic nervous system. breathing with your mouth open signals to your body that there's danger, and you will go into sympathetic nervous system. We want to encourage and to train our bodies to be in rest and digest. And one of the best ways to do this is through slow, light, nasal breathing. Continue to pay attention to your breathing. Continue to notice the cold air coming in through your nose and slightly warmer air leaving the nose. Look down at your chest and your abdomen again. Can you see your breathing? If you can, then maybe you want to lighten your breathing. Really concentrate on your breathing and use this as a measure of your concentration. When you're concentrating on your breathing, it's much more difficult for your mind to wander. We have 60 to 70,000 thoughts per day, and we can lessen this by concentrating on our breathing. It's very hard for the mind to wander and go on its tangents of worrying about the future or ruminating about the past if we're concentrating on our breath. How long can you hold your attention to your breath before the mind wanders? If your mind is wandering a lot, you will get even more from this exercise. Keep bringing your attention back to your breathing. Feel the slightly colder air as it enters your nostrils, and feel the slightly warmer air as it leaves your nostrils.